Hey, Bill. How are you? I'm giving you guys a little time to log on, sign on to this this latest Periscope. So I'm just gonna wait a few seconds more so that more people can log on and sign up for it. In the meantime, if you guys have any comments, feel free. You're more than welcome to, ask any questions or comments. And my email address is jt@elitehealth.com. If this is your first time joining in, this is Dr. Tolentino from EliteHealth here in Miami Beach. In the past, I've discussed different types or aspects, healthy habits on wellness. And one very important aspect on that is understanding that your hormones, or lack thereof, do play a crucial role in your aging, your development, and your overall wellness and well-being. The first hormone-specific lecture or Periscope that I had done, I had focused on testosterone and how important testosterone was for us. Next, this basic lecture is going to be on estrogen and how important estrogen is. Hormones are really only one aspect to understanding how wellness is. For example, as we age, we have a lack of hormones. So that lack of hormones is responsible for actually a number of things that you don't think they're really responsible for. Testosterone we've discussed briefly, and I'll go into more detail on that later in another Periscope. But estrogen is very, very important. Estrogen is mainly, we characterize it as a female hormone. And we really say female hormone because we think that, I guess you'd say it's a misnomer. You think that estrogen is made only by women, and that's not true. Men actually do produce estrogen. Testosterone actually can even convert to estrogen. Fat receptor cells in the visceral area can also, hold on to estrogen. But too much estrogen or too little estrogen, just like in any other sort of hormonal imbalance, it causes problems for a lot of people. As we age, the estrogen levels decline, and mainly for women, you actually do get a lot of side effects from that lack of estrogen. In my office, I have a lot of the women fill out a questionnaire if they have any sort of symptoms that seem like they could be hormonally related. For example, the most common symptoms that I have of hormonal imbalance in general for women that come in include like the hot flashes, mood swings, fatigue, chronic headaches, also vaginal dryness, can't sleep very well, insomnia type issues, issues with their periods where periods aren't regular. They start happening every month. Next thing you know, they're every 4 weeks to every 6 weeks to I'm not getting it every 4 weeks like I'm supposed to. I'm getting it every 2 months, breakthrough bleeding in between. I also have patients that have, painful, swollen, or even tender breasts. I do have gentlemen that come in with estrogen excess symptoms. They have gynecomastia. I also have a lot of women that start to notice a lot of lower libido, also depression, also anxiety, weight gain. Those types of things are really contributed to the lack of hormones. Estrogen is one that definitely plays a part there. So yes, estrogen is produced in men, but at the same time, the estrogen that I'm focusing on for this Periscope is mainly related to women. Now, a book that I read recently was a book called Why You Can't Lose Weight by Dr. Smith. And it's more or less goes through a lot of the main reasons why we have difficulty losing weight as we get older. The main thing that she discusses is hormone imbalance. And I've said this before, it's important for all of the hormones to be balanced in order for you to feel your best, for you to look your best, for your body to function its best. Even psychologically, cognitively, how important that is. So female hormone imbalance, one of the major things is to pay attention to the three main hormones like estrogen, testosterone, and progesterone. Progesterone, they call it like estrogen sidekick. But progesterone, there's many beneficial uses, needs for progesterone. We're going to discuss that at the next lecture. Estrogen, even though it's a female hormone and men still produce it, the main important thing to note is that it's responsible for a lot of things in our bodies as we get older. When we were younger, it was helping with basically helping our periods start to regulate. As we get older, it's also important when you're discussing blood flow, concentration issues. It was helping with your cholesterol. It's also helping with your bones. It's important for people that are also potentially going through osteoporosis or even osteopenia. It also helps our risk of heart disease. It actually focuses in on cleaning out the arterial plaque. It also decreases our bad cholesterol and helps increase our good cholesterol. Estrogen's even responsible to help collagen, so that's why a lot of people when you're younger, you notice their skin is nice, and as you get older, with a lack of estrogen in their bodies, then their skin starts to sag, more wrinkles start to appear, and that lack of hormone or lack of estrogen is what contributes to that. So those are the major things that I've discussed in one specific chapter in regards to estrogen. There's actually 3 different types of it. So estrogen in our bodies is made in 3 forms. The most common or most, measured form that we often look into is really the estradiol. Estradiol is responsible for a lot of the things that happen during our age before menopause. And when you have that lack of estrogen as you get into menopause, usually another form of estrogen takes over, and it's not quite that estradiol active form. So when I mentioned the whole idea that it helps to maintain memory and it helps with fine motor skills, it also helps with your brain, your blood flow and circulation. As you get older, the more that the estrogen declines, and the same with the other hormones, it's going to affect that. You can have brain fog, you can have issues with your cognitive ability, you can have issues of memory loss or memory impairment, whether it's short-term, long-term, noticing a few minor things here and there. So it's important for you to think that hormones like estrogen are responsible, or lack thereof I should say, are responsible for these things. So when you go see your doctor, make sure you get your hormones checked out, male and female, and that they check out not just 1 or 2, but all of the hormones. So I still think of hormones as like that symphonic thing. It's almost like an orchestra. I think of each hormone as each different instrument, and when they're all working and they're all balanced, it plays a beautiful piece of music. So estrogen and lack thereof, it's important for us to realize that as you get older and as you age, the lack of estrogen is going to cause a lot of the symptoms that we have associated with aging, including the memory issues, including the heart disease, including the issues with our circulation, issues with our bones, and so forth. So if you want to learn more, let's discuss progesterone in our next Periscope, where we can go through more details regarding progesterone and how important that is. But in the meantime, remember that estrogen is important for all of these things, and lack thereof, as we get older with aging, it does need to be addressed. For some women, actually a majority of women, estrogen replacement therapy can be an option as we get older. There's no reason to go through menopausal symptoms without addressing it. So of course, we can do as much as we can with diet, exercise, doing our best with everything else, but at the same time, all of the hormones should be addressed, and hormone education is important. So if you want to go into more details on whether those types of things would be an option for you, and you have any of the symptoms that I mentioned, like the irritability, the hot flashes, the mood swings, the issues with weight gain, vaginal dryness, trouble sleeping, always make sure that you pay attention to your hormones. And yes, lack of estrogen is definitely one that can be responsible for a lot of those things. The next Periscope next Wednesday, we're going to focus in on progesterone. I think progesterone is huge for a lot of women. It's really another one of those things where it's the lack of progesterone that actually causes a ton of problems. So I hope you join in next Wednesday, and we will learn more about progesterone. I will see you then. Take care.